DTHF Research Meetings, your deep dive into the latest in research.
To Lilita about the documentary, about his life since then, since, as I mentioned, this documentary was completed a bit over a year, almost a year ago. Also ask Lilita perhaps to say a bit about what you've been doing, about your journey with your transition since this documentary was made, if there have been any developments that you want to share.
Can I start?
Yeah.
Sure. So, what do you want to say?
About since this documentary was made, changes in your life.
Okay. Thank you. So, well, since we started making the documentary, so I wasn't focused very much on everything else. I was focused on the physical transition that, okay, my body is going to change and everything is going to happen. I'm going to get a beard and whatnot. I wasn't really focused on my relationship with my mom or my relationship with myself and how it would affect me psychologically or anything. So when we started the documentary, it actually helped me to like realize all the other stuff, and it helped me to also like to be able to better navigate it. Also like just learning about the LGBTQI plus community, because I didn't know a lot. I knew about so I found about I'm trans. I found it now, but I didn't really know a lot about transgender people. So then like when I started working with the DTHF and attending all the SOGI workshops and sharing my lived experience, it helped. It helped because I learned a lot from it. And yeah, I used to think that like, why do I do some of these things? Like I didn't understand that. For instance, at the Sogi workshops, I learned that a lot of people who are like me, who are in the LGBTQ community, will might like, get into substance abuse because of certain things like rejection and other stuff. So it cleared things up for me, because I used to just think about, ish, Lilita, like I just used to think, but I'm just doing too much.
Feeling like you were alone in that experience.
Yes, yeah, and I was alone, and I can't talk to people about it because they just won't understand, and yeah, they probably have a lot of other stuff that I do need to hear to say about it. So it really helped, and I'm just learning about myself more and more as I attend more surgery workshops and do things with the DTHF. And yeah, the documentary has helped a lot with that. Thank you so much.
You can take this first online hand. Abby, you can unmute. Abigail. We also have a hand in the room.
That's enough, but I have a question. Yeah. One thing I'd love to hear more about the happiness and the joy that that has come into your life since you've come into your full self. Was like, it's like I'd love to hear more about like did you feel like a more full person? Do you feel joy? Do you laugh harder? Do you smile more?
Yes, I definitely feel joy. Thank you for the question. So I do feel joy. I'm just struggling sometimes, especially now, because initially at the beginning, I was having a really good time. Like I said, I was so focused on the physical changes. So the first few months, it was all about everything new that I'm seeing. And yeah, and I changed a lot. And even when my mom would see me and be shocked about, Lilita, why is your chest flatter? Like, for her, maybe it was like a no, but for me, when she saw that, it really got me excited. Like, yeah, you see, and my friends also, I have a lot of friends who are guys here in Cape Town. Every time they see me, like after a while, they'll be like, oh, maybe I'm just, handshake. I'm giving them a handshake. So someone will be like, hey, why is it like you're stronger now? They will see the little things, and because some of the people they didn't even believe. So I believe in that. So yeah, I get a lot of validation from that. But also, so now I'm just trying to, now I think because like it's not, initially everything was happening so fast. Now it feels like things are taking longer to happen. I'm so focused on what I'm not seeing. But um, all in all, like I'm so happy. Like even putting on clothes feels better, and being outside, it's great. So uh, yeah, I'm just trying to be more confident about it because I see it, especially when I'm alone. But then when I'm out with people, sometimes it's more difficult. But it's really nice.
First question from Ace, thank you.
Maybe we can go to Karabo.
Yeah, Karabo, Siapi.
Hello. So yeah, I have many questions for you, but I think let's start here. Given everything that you have been through up to this point, would you advise any other person who is more or less going through the same to target the physical aspect of it first, or the emotional aspect of it, in terms of getting ready? And I don't necessarily want to say this is almost like you have like a new life, but it's quite a huge adjustment, especially based on the fact that you would, in terms of family, friends, and community as a whole. So where do you think it would be ideal for someone to actually start the transition process? Would it be the physical, or would it be more the getting ready mentally, emotionally, especially to deal with everyone else's reaction and emotion?
Thank you, Karabo, for the question. I think that it's important for you or for a person to be in a good place emotionally before they start transitioning. But I don't think I can speak for everyone. Maybe transitioning might help them to be in a better space emotionally. So I don't know, but I think it's very important for you to be in a good space emotionally and speak to people who can help you, speak to your family, speak to friends that can help you, that people you trust, because you're going to need people. You will need a community when all of this is happening. And yeah, if you're not in a great space emotionally, it's going to be tough. And like I said, substance abuse, and you might find yourself in a more difficult situation.
Can I also add to your answer?
Yes.
To say that medical transition involving hormones or surgery, when it's prescribed by a doctor, does require some counseling or psychosocial support before accessing hormonal therapy or a surgical procedure. There's always counseling involved as a step that everyone goes through, even if you don't have other mental health issues or diagnoses such as depression, anxiety, PTSD, which many transgender and gender diverse people do have. So it's about providing them with holistic support and, as Lilita said, making sure that people have the support they need when their life inevitably does begin to change.
Okay, I think let's take another question. Kavan, not sure if I'm saying that right. You can unmute yourself.
It's Kevin.
Kevin, sorry.
So I think someone sent their question in the chat.
Okay. For those who move on to Nkosi, if you want to unmute yourself, I see your hand is up.
Hey,
There we go.
let me try to. Hi everyone. So my name is Nkosi and I'm based in East London. So my question is around if I understood correctly during the documentary, you are mostly based in Cape Town and you also have a home in the Eastern Cape. So I wanted to find out in terms of the overall support system and looking at the environment as a whole. I know already there are differences between the Eastern Cape and the Western Cape in terms of the kind of support the general population and how people view LGBTQI. Where should the Eastern Cape start in terms of having the kind of understanding, the kind of support that one will get in Cape Town compared to the Eastern Cape? It can be like a general response or based on observation and based on experience. Thank you.
Yeah.
I guess anyone can comment on that. It doesn't just have to be Lilita. So.
Okay. Well, thank you, Gosi. I think Lilita has thrown that question to me. So there's still a lot of work to be done. There are some organizations who provide support in the Eastern Cape. So we have Social Health Empowerment, we have one in Duncan Village in East London. I think they are largely focused in East London, but the closure of Nova and Men's Health Engage and other various facilities has put a strain on the type of support, health-wise, socially, that transgender those people can receive in the space. I think it's up to programs. I think we as Desmond Tutu have the social universe that we try and engage healthcare spaces in, but also engage communities. So some of that learning and unlearning needs to happen in real time within the communities, the families, the friends of transgender diverse people, so that they can provide that social support in that space, making it easy for people to transition. So Lilita often shares that when they were in Joburg, being around the boys who were affirming and who acknowledged him as part of the group was quite something liberating for them. And I think it speaks to the question of euphoria, that from dysphoria, feeling that you feel divorced from self, alienated, being recognized and being included and being seen is a sense of euphoria. So this conversation that we are having, the social universes that we have presented, but also continue to present in the various workshops around the country, are such methods of where we can open up the understanding on the platform for support, so that it transcends all layers and institutions. Yeah, that's quite a broad answer there. Yeah.
No, that's fine. Just maybe last comment. Please don't neglect us as the Eastern Cape, the LGBTQI division in Cape Town. We need it in the Eastern Cape as well. Thank you.
Thank you. And get the messages from the chat.
I'm just having a look.
Oh, looks like Kate
Kevin's back. Great.
joining us on video.
Hi guys, I'm Kevin. I'm from Port Elizabeth. Just to support that, Sambanda was saying about Eastern Cape has been abandoned, and it is quite true because I've been on testosterone now for a year in few months, and we never had support for using facilities of having some facilities at Port Elizabeth. We also had like one facility that closed down recently. As you know, guys, what happened at USA was not supporting the fundraising of being a transgender person. So for my question is, it's becoming difficult for us because at this moment we don't have support of doctors or medical aid or people that is supporting us physically of going to a state of going to get some medical how can I say support like to say like you want like maybe support of mental health. We all know that that's a very important thing that's going on with transgender male and transgender female, that we don't have the ability of going to public hospital because they don't understand the things that we are going through at this moment. So for my thing that I wanted to ask is like, do Cape Town really support us in that area of we are struggling to have this thing sorted out in Eastern Cape?
Okay, Lynn has a hand.
I have a question for Lilita first. Also, hi everyone. I'm Lynn. I'm the research project manager for the LGBT plus health division. So thanks Nadine and team for having us here at head office, and great to see so many people online as well. We've been working with Lilita for a little while, so it's very exciting that we've got this platform to share the documentary on. So Lilita, I think also from your side, part of the follow-up, if maybe you just want to share a little bit about where you were accessing care and what's happened this year in terms of your access to hormone therapy. And then I have a little of a follow-up that I can also maybe address Kevin's question as well.
Okay, thank you, Lynn. So I was also receiving my testosterone at Wits, RX Clinic in Belleville, here in Cape Town. And after the whole PEPFAR USA thing in Trump, it closed. So now just before it closed, I got my last vial of testosterone, which I'm still using. It's about to run out soon. I haven't really gotten another service provider for me to get my testosterone, but I spoke to Uzim. I spoke to someone who's also taking testosterone, and they said that they can accompany me to Plumstead Hospital, where we'll try and get my testosterone there. But otherwise, I need to go get my referral in Belleville Clinic, which is from Wits, and then I need to go find another service provider for my testosterone. Yeah, and it's very stressful for me. It's something that's been on my mind for a while, and I need to do that before my testosterone runs out in a month, probably. Yes.
Thanks, Lilita. So, I mean, Kevin, you 100% have Cape Town support, but as you can hear from Lilita's story as well, trans people are facing the same challenges in Cape Town as well. And this is a global challenge that we're now facing given the USAID and the PEPFAR funding cuts. So we need to stand together as a collective. And something that the LGBT plus health division here at Desmond Tutu is piloting at the moment is something called the South African Healthcare Equality Program. And both Lilita and Olivia mentioned that with the SOGI workshops. So just to explain that a little bit more, it's a program that's working primarily with public sector, but can be for any healthcare facility, public or private, because you mentioned that right now, LGBTQ people, not just trans people, any queer people, don't feel safe accessing the public sector and going in there because there's no education and awareness around queer people and their health needs and any health service provider curriculum or any engagement or awareness after that. So that's what we're trying to do, is work with these facilities to give them that knowledge and understanding. So there's a series of 3 workshops, and then we spend some time with the facilities as well as the district management team. Working over the course of a year to basically move towards making those environments more inclusive. We have also been piloting it in Desmond Tutu Health Foundation itself, so at the different sites, and I know we have a lot of different sites joining today too, including East London, which is great, but we've also been rolling out the workshops. We haven't come back for workshop 2 yet at head office, for example, so we'd love to come back and do that. But really what we'd like to do is see that program grow. Right now, we're just piloting it in Cape Town, and we've been working a lot in the central Karoo area as well, which is a rural area which also faces different challenges than here. But we're hoping to see that grow, that we can come to East London and do those workshops as well in the Eastern Cape. Yeah, so the support is there, we're building that, but we need to also work together as a collective in order to make those changes to make the public sector services more accessible.
Thank you for that. Can I have another question? So as you say, there is a support. How at this moment where one of us, like me as myself, can go to for support group, like maybe if I have struggle with mental health or anxiety or depressions, and like we don't have blood, we can't do blood work also. So is seeing a doctor at this point, is there any other way that we can see a doctor that we don't need to pay like a like expensive doctors, that must be not expensive for us, because it's like it's really affecting us, like, you know, some of us is not working. As you can see, I am working, but yeah, some of us don't have the funds to go to a doctor, private doctor, to get blood work. So if someone can just like point us to the right direction where we can like have someone that can know of people in Port Elizabeth, that we can go see a doctor or someone that have, like, you know, the qualification to assist us there.
Yeah, definitely. That is a very important request there. I think the scarcity of support has really put a lot of strain everywhere. I think even the Joburg towns have struggled a lot as well since the closure of VITRHI. I see a lot of people do seek out support in support groups. You might have like a trans men support group in the area or perhaps in the region. And that has really provided a lot of support for other people as well. If ever there are services that people can access, then there's a nice network that people can share in that space. Also, I know Buffalo City is quite far from Port Elizabeth, but there are doctors there who are providing gender-affirming care in Buffalo City. So maybe at the Free Hospital, seeking out a doctor who's able to assist with the blood work, and then they have days, clinics that call them, that are particular days where they do provide hormones. So I think you are signaling a need for a hub of sorts, that where people who do need this type of information can go. Often than not, you find them social media and Facebook groups, transgender Facebook groups as well. And that can be a nice place to start, and then maybe narrow your network down to quite close to your region so that you're able to get those services much closer to you. But in pockets, they are there, but it really needs us to have maybe something more central or available or advertised for people to see as well. But yeah, we definitely share it with your query and your ask here. Yeah.
Thank you so much for that. I appreciate your guys' info and the time for me to just reach out there for my side of transgender people that is in Port Elizabeth. Thank you so much, guys.
Yeah.
We have some questions in the chat. I'm just going to read them as they are in order, one by one. First is from unknown user. How do you feel when you're alone? Do you feel people are accepting or just tolerating because there is nothing to do?
Thank you. So when I'm alone, yeah, I struggle when I'm alone. So sometimes I feel like they're tolerating me. But then I know with some people, there are certain people that I like. I know my mom isn't tolerating me. I knew she was going to have a hard time with accepting it, but I know she's not tolerating me. And then there are certain people, certain friend groups that I won't stick around a lot of times with because I do feel like sometimes they're tolerating me and it's in the way they treat me or they don't see me for who I tell them I am. So then I will feel like those people are tolerating me because sometimes it will be small things they say, how they address me, small jokes. No, it's just a joke. Like everything about me will just be a joke to them. So in those spaces, I do feel like, yeah, these people can say that they love me, but they're just tolerating me. And then there are people who I just know, I just, yeah, wanna. Yeah. So yes, it's different with different people, and it's all about the way they treat you. When I'm alone, I will struggle with those things, and maybe try to convince myself that these people don't care, but they always show up, and they do care.
You have new friends that celebrate you? Because like when you walk in the room, you light up the room. So I'm assuming you have new friends who recognize all.
Yes, I do. I do, Ace.
And someone asked, is it possible to find the documentary online? I unfortunately missed it.
Yes, it is on YouTube. I did post it on YouTube. Search Lilita Sangita. You'll find it there. Mirror him.
Great, thank you. We've got two more questions in the chat. One is for you and one is for us. For you, Lilita, in terms of general medical care, do you find that you have to declare that you were female at birth to clinicians?
Because of my ID. My ID hasn't changed. So whenever I have to go and see a doctor or anything, I have to bring my ID, and it does unfortunately still say F, female. So I don't tell them, they just see there, and maybe they might have questions for me. With them, I just think a lot of doctors also still need to be educated because some of them don't recognize you for who you tell them. They just look at that F and they go with that. But yeah, I do have to because of my ID. Otherwise, I think if it wasn't for my ID, I wouldn't necessarily tell them.
And the question for us is, can't Desmond Tutu partner with CPD.org to offer double or more CPD points for LGBT seminars in order to incentivize health workers to learn about these topics?
Yeah, we could do that.
I'll say 4 of the workshops that we offer, and there are 4 points for each of these workshops. There's a different balance of ethical and clinical points for each of the workshops, but we have motivated for the CPD points, and we have got ethical and clinical CPD points for all of our workshops. We could have more and more incentive just based on points. I don't know. I think there also needs to be incentive coming from people recognizing that there's a gap in their knowledge and that impacts on their ability to give appropriate and affirming care for all of the clients who come their way or all of the patients who come their way.
I'm sorry, just to add to that, the first workshop in a series of workshops is our Soji workshop, which has 3 ethical points, and the ethical CPD points are very hard to get. So doctors are looking for ethics points. They need a certain number of ethics points for that. So I'm going to pop my details in the chat now. So if anybody is interested about that, about the program and the workshops, please feel free to reach out to us as well, and we can give you a lot of information about that.
Okay, we have
There's another hand up as well.
want to read that?
Celia.
And Karabo has a hand again.
Last question from me. Well, a question and a comment maybe. I don't know, but anyway. So I'm the one that actually asked the one question about the general medical care. I'm not sure if we have any doctors that have joined. But however, I asked that question because in terms of medical care, there is differences when it comes to like your reference ranges when you are born male or when you are born female. So I'm not sure if there is any, or if we have any research in terms of having to have followed a transgender person medically to see, you know, if there are any changes, especially because you are taking hormones, you are taking supplements, which is why I asked the question that you do, or do you have to declare? Because sometimes in terms of treatment, that might be a factor where you find that, you know, if you were born, just an example, if you were born female and your BP is reading a certain level, if you're female, that might be normal, but if you're male, it might be abnormal. So, which is why I asked that question. I'm not sure if there's maybe any doctors that have joined that can assist with that question, maybe in terms of, you know, are there any differences from a deeper medical view?
So can I answer? This is Ace. I direct the Sexual and Gender Minority Wellness Program at Duke University. So all of my researchers, this is exactly what they do. So are you asking specifically around HIV prevention and treatment? Or are you asking about longevity of care with hormones? Or are you asking for both?
Both.
So when it comes to HIV prevention and treatment, we have plenty of data. We've been very forward and making sure that research is developed from conception all the way through stage 4 of research, where you're looking at general population health, to make sure that no matter what individuals who normally take any type of gender-forming hormones, because like gender-forming hormones are often used by cis people in addition to gender minority populations. So we have plenty of data to make sure that things are safe and effective. And so we are good there with just about every medication that is available that has been of use probably since 2013. And when it comes to long-term care, the big piece is to make sure, I think, like as for individuals who are under the care of a doctor. So someone who might be taking like 0.5 cc's and working their way up to a certain level of hormones, same thing with estrogen or any other type of care, to ensure that the individuals do not have any liver function issues, any kidney function issues, any other issues that can occur with any sort of gender affirming care, whether or not you are identified as a cisgender person or as a gender minority. So to put things simply, we have a plethora of data to support that there is no long-term challenges for individuals who are under medical care. The challenge is for individuals who are in places where they have to take street hormones. So like a big fear is that there might be individuals who are going to get hormones off the street that are less regulated. And those are when you have additional challenges. So you might have individuals who are 50, 60 years old who have been on hormones since they were 17. And those were street hormones for the first 20, 30 years before they were under medical care. And that's when you have this wide range of issues around kidney failure, liver failure, so on and so forth. But the things that we have now are very well controlled and very well monitored to ensure there's not going to be additional problems going forward. So the short answer to your question is no, there's not any problems. Everything I just said in the last 3 minutes all comes down to no. I hope that's helpful.
Yes, it is. Thank you.
One more comment, which is I want to congratulate you for the big step you took. Never feel ashamed of who you are.
Very nice.
Nice to know.
Thank you.
Yeah, that does sound like a very good motivation to end on, because I think our time is up. Is there anything anyone wants to add in closing? Otherwise, we will end the meeting. Of course, we're in the room, we can still linger on a little bit, but for online, I think we will end it here. But Savuka, you seem keen to still add something?
Yeah, sorry, I'm just
No.
by these questions.
Go ahead.
So I think it's worth saying that during COVID, there were a lot of general practitioners who are offering gender affirming care via telemedicine. So they'll have online consultations and then they'll post your hormones to you. I do recognize the need for bloods, and I think that would need a sort of agreement with a local hospital, the closest tertiary institution near you. And that is something that I think we are trying to establish here in Cape Town, and maybe some pockets of activists in other spaces might be too. But in the meantime, I think accessing telemedicine in the likely event that you would run out of hormones would perhaps be another alternative for you to explore, right? So yeah, I have my doctor here, a family practitioner. If you say mydoctor.co.za, you might be able to find that person. Also, Anastasia Thompson would also be able to either provide or point you in the right direction. So good luck.
Okay, I think then for our online audience, thank you everyone for joining and for the engaging conversation. Thank you for Lilita for coming today and sharing your story, and our LGBT plus division for hosting and suggesting this platform to share your story and opening up the conversation.